Let's talk about health checkup for the heart. Did you know that ECG is not the best test to detect heart disease risk? And ECG can be normal in a heart attack? What causes a heart attack? When a blood clot forms inside an artery to the heart, it causes heart muscle to die, and this is called a heart attack. What causes a blood clot to form? When fat collects in a coronary artery, it's called a plaque. Unstable plaques can rupture, causing platelets to gather there, forming a clot. What tests are done to assess heart disease risk in the clinic? First of all, weight, height, and BMI. BMI, or body mass index, is calculated by weight by height square. Overweight and obese individuals are both at increased risk. Blood pressure is monitored twice in the morning, twice in the evening at home the week before coming to the clinic. At the clinic, 2 readings of more than 140/90 is consistent with hypertension. Fasting sugar of more than 125, random sugar of more than 200 with symptoms, 2-hour ppbs of more than 200, HbA1c more than 6.5 is diabetes, FPS of 100 to 125, 2-hour ppbs of 140 to 200, HbA1c of 5.7 to 6.4 is prediabetes. Both are at increased risk. Fasting lipid profile, we check for high LDL, low HDL, high triglycerides. ECG is done to assess heart rhythm, any new or old evidence of heart attack, and thickness of the heart wall. Note that ECG can be normal while the patient is having a heart attack. A treadmill test is done to assess if the blood supply to the heart drops during exercise. Note that 30% of future heart attacks can be averted by using treadmill tests, but 70% of future heart attacks happen despite normal treadmill tests. A person can have normal treadmill tests even when 70% of his coronaries are blocked. Therefore, the gold standard for detecting coronary artery disease is an angiogram, preferably a coronary angiogram where a catheter is placed inside the artery, or else a CT angiogram. An echocardiogram is done to see how good the heart is pumping, whether there are any leaky or tight valves, and any heart muscle that is dead and not moving, or if there's fluid around the heart. It's not a screening test for heart disease in an otherwise healthy individual. It's useful in someone who has already had a heart attack to see the pumping effect of the heart. To know about which vitamins boost immunity, do subscribe and press the bell icon for notifications.